Week 1 Pregnancy Symptoms. Missed period. One of the earliest signs of pregnancy is a missed period, says Dr. Zore. This is often what prompts someone to take a pregnancy test. However, it's important to know that this missed period may happen after the first week of being pregnant. Most people miss their period 2 weeks after conception, since implantation tends to occur 2 weeks after ovulation, and therefore about 2 weeks before the next period starts. The ovaries make estrogen and progesterone throughout the menstrual cycle to build up and stabilize the uterine lining. Pregnancy hormones will stimulate the ovaries to continue to make estrogen and progesterone, so if someone is pregnant, they will not experience bleeding or a period. If there is no pregnancy to continue to encourage the ovaries to make these hormones, then the lining will shed and the person will get a period. Breast tenderness. Besides a missed period, Dr. Zanotti says that another one of the very earliest signs of pregnancy that can occur during week 1 is breast tenderness. What happens during implantation is that cells are starting to form to become the placenta, and then you start getting more of the hormone human chorionic gonadotropin, HCG, which is produced by the placenta, she says. Once there's HCG in one's system, someone can start experiencing early pregnancy symptoms, including breast tenderness, she explains. Some people may experience breast tenderness in a specific spot, while others feel sore all over their breasts or under their armpits. According to a study in the Journal of Clinical Nursing, 76% of people experience breast tenderness during the first trimester. 1. Nausea. A lot of women experience nausea or an aversion to food, Dr. Zanotti says, naming another early pregnancy symptom. To her point, nausea and vomiting was the top symptom people in the Journal of Clinical Nursing study experienced, with 88% of people experiencing this symptom. 1. Just like breast tenderness, Dr. Zanotti says the reason for nausea is connected to the rise in HCG. People who experience nausea and vomiting during the first trimester tend to have higher levels of HCG than those who don't experience these symptoms. While nausea and vomiting are no fun to deal with, these are normal symptoms of pregnancy and not cause for concern. Fatigue. Both doctors say that fatigue is another common and normal symptom of pregnancy, including in the very early days. This is due to a change in hormone levels, not just with HCG but also progesterone. Progesterone levels rise significantly in early pregnancy. This stark change causes the heart to beat faster to help supply the developing placenta and fetus with more blood. But it can also make you feel more fatigued as a result. Cramping. Since becoming pregnant puts a pause on getting your period, that means no uncomfortable premenstrual cramping, right? Not exactly. Both doctors say that experiencing cramping during early pregnancy is common. Cramping in early pregnancy can be normal due to early expansion, including growth of the uterus in pregnancy, says Dr. Zore. Other causes can be due to gastrointestinal symptoms such as constipation, gas or bloating. If cramping is causing you severe pain or is accompanied by bleeding, Dr. Zore says it could be a sign of either miscarriage or ectopic pregnancy, and it's important to see your doctor. Bleeding. Experiencing bleeding in early pregnancy can be stressful. There are several different reasons why this can occur, according to Dr. Zanotti. The number one thing we worry about with bleeding in early pregnancy is a miscarriage, she says. Bleeding can be a sign of an abnormal pregnancy, which is called an ectopic pregnancy and happens when the pregnancy does not implant in the uterus. But this is not the only cause of bleeding in early pregnancy. Sometimes, bleeding occurs from the implantation, she adds. She explains that this is because when implantation occurs, it disrupts the lining of the uterus, causing light bleeding. If you have bleeding in pregnancy, review it with your own doctor to know what's happening in your pregnancy.